one. No one was being a prosthodontist. You deal with the other end where lawyers are having cases that were disaster. How would you keep? What advice would you give young dentists to stay out of lawsuits and state boards? What kind of cases are red flags for you? Or I mean, do you? Well, let me just say this. Do you do a lot of redo work, and are cases sometimes sent to you from attorneys?
So,
That's a yes or no question,
yes.
Your Honor.
I do. I do redo cases, and I do expert witness work, and red flag cases.
Are they using a certain type of case, or does the 80-20 rule come into play?
Yes, and it's funny, and I don't want to step on toes in any ways, but
Please do. It's Dentistry Uncensored.
I know. Although I have to say, more recently it has calmed down, but for a good long while, a lot of the cases that we were seeing as law cases were LVI cases. A lot of the LVI trained general dentists that would go take the LVI courses were coming back thinking they were prosthodontists, really, doing full mouth rehabs, and we saw a fair amount of those, a lot of those. I mean, and it was a classic look. You could tell as soon as that patient walked in and sat down in your chair, you could instantly tell it was an LVI case.
And that's because it's neuromuscular dentistry as opposed to CR?
Yeah, there's a whole lot that goes into that. But they were usually always over opened. The patient was over opened. They were really over prepped. A lot of the cases, a lot of subgingival margins where you would have invasion of biologic lip with the overprepped TP, and then overopened, bright white. You can see them a mile away. So now, so I think it's shifting. We don't see as much, I haven't seen as much of that now. We are seeing maybe more of the implant cases, a lot of, and Dr. Ty could probably attest to this, is